Hello, thank you for joining us tonight. I'm Mary Ann Ahern, the political reporter with NBC5 here in Chicago. I'm also a mother and a grandmother. One of my dear loved ones is a type 1 diabetic. So this is an issue, a topic that is just near and dear to my heart. I have had a connection to the Kovler Center for Diabetes now for 10 years, and this is the place that you want to be. It is the very best when it comes to care, and as you will witness tonight, timely topics tied to diabetes. I'm so glad to be a part of this important discussion because we all know that managing mental health can be challenging. So let's get started. I want to introduce you to Al Taylor. Al is a member of the University of Chicago Kovler Diabetes Center Leadership Board and is also the co-chair of the Salon Kovler 2022, established back in 2011. The Kovler Leadership Board of volunteers and philanthropists, they share a passion for Kovler and supporting those facing the challenges of diabetes.
Thanks, Mary Ann. On behalf of the Kovler Diabetes Center Leadership Board, I'd like to welcome you all to this year's Salon Kovler program, Caring for Your Mental Health. Joining us today are fellow members of the Kovler Board and their friends, as well as volunteers, patients, and families, and other supporters of the University of Chicago Medicine and the Kovler Diabetes Center. I'd like to take a moment to thank our board chair, Sally Kovler, for her leadership, as well as my event co-chair, Sam Tolman, and Lisa Walker, who gave rise to this event and chaired the previous programs. The topic we'll explore this evening is the psychological side of diabetes and the importance of recognizing, understanding, and overcoming the real-life emotional demands of living with diabetes. It's always important to look after our mental health, but even more so as we continue to navigate the COVID-19 pandemic. Joining us this evening is a distinguished guest speaker who will provide some stage setting remarks on this topic, followed by a panel where he will be joined by some faculty from the Kovler Diabetes Center. This will also be a chance to talk about some solutions, hear firsthand stories, as well as answer some of your questions. With that, I'll hand it back to Mary Ann, and I hope that you enjoy the program this evening.
Thanks, Al. With that, I'd like to welcome our first guest of the evening, an award-winning actor with an extensive career that includes roles in Titanic, Legally Blonde, and a current series regular on NBCU's Family Law. Victor Garber is well known for his captivating performances and impeccable character development. What you may not know is that Victor has also been managing diabetes since he was a teenager. He joins us now to discuss how he's been able to build such a successful career amidst the challenges of living with diabetes. Victor, thank you so much. Can you give us sort of a brief snapshot of your journey with diabetes?
Sure. I mean, it's been a long journey. I'm now in my 70s, and I was diagnosed when I was 11. So you do the math. From the time I was very young, I was always, it never deterred me from pursuing what I wanted to do. And I think, if I had one sort of catchphrase for anybody out there who's been diagnosed at an early age or even middle age, it doesn't have to stop you. You just have to pay attention to it. You have to respect it. You have to, and also with technology now, my life is completely changed from when I was a child.
What does diabetes and mental wellness mean to you?
Well, it's everything. I mean, you can't differentiate. I mean, it's all part of the same thing. Mental wellness is important to everybody. And we're experiencing all kinds of revelations about people who haven't been able to talk about it, and now we are, and that's a big problem or a challenge for diabetics, because often your blood sugar affects your mental state, and also I have gone to meditation on a regular basis, and certainly just sitting quietly and breathing to calm myself down when I get myself into a state. And those kinds of things are any kind of exercise is crucial for diabetics and also for anybody who's going through any emotional issues. I mean, to take walks, to do exercise, any kind of exercise.
I find your discussion so valuable. I have a son, a 29-year-old who's a type 1. What advice do you give other diabetes patients about how to care for their mental well-being while also managing this disease?
First of all, talk about it. Do not shy away from talking about it. There, even if you can't talk to your parent, there's a whole community beyond type 1 out there on the websites that you can have conversations with people. You must not withdraw. You must force yourself to get out and either do something for someone else but be sure you express your feelings. There's nothing to be embarrassed about, and there's nothing to be shy about. I mean, as an actor, I'm used to that. I know what feelings, I know how to express myself, but there are a lot of people who are ashamed, who feel they shouldn't have this disability or whatever they want to call it. And we're all, and the fact is, we're all going through it. So you're not alone.
Absolutely. Victor Garber, you're just fantastic. We so appreciate your thoughts, your perspective, and how you have managed diabetes over the years. Thank you very, very much.
Well, thank you for everything you're doing too. And thank you to Kovler.
Absolutely. The best. Thank you very much. And coming up, much more on mental wellness and diabetes. Let's provide some stage-setting remarks on the psychological side of diabetes. And I want to introduce you to our keynote speaker tonight, Dr. William Polanski. Dr. Polanski is the president and co-founder of the Behavioral Diabetes Institute, the world's first organization wholly dedicated for studying and addressing the unmet psychological needs of people with diabetes. He is also the associate clinical professor in the Department of Medicine at the University of California, San Diego. Dr. Polanski, he has authored several books for the lay audience and is the winner of the 2020 American Diabetes Association Outstanding Educator and in Diabetes Award. We're honored to have him join us for tonight's event. Take it away, Dr. Polanski.
Thanks, Mary Ann. Hello, everyone. I'm really glad to be here with you. Again, my name is Bill Polanski, and I am a diabetes psychologist. In fact, I've been one for more than 30 years. And I remember back when I started at the Joslin Diabetes Center in Boston, didn't really know what I was doing. First person I ever met, I was in the waiting room, and I just would walk up to people and say, "Can you tell me what living with diabetes is like for you?" And that first person told me a lot. I've asked that to pretty much everybody I've met with diabetes since then, and over 30 plus years, I've managed to talk to many, many thousands of people who help me understand what diabetes is like from their perspective. And so it's really nice to be able to talk about this link between diabetes and emotional health. Many people will say, well, what link is there? And it hopefully is pretty obvious when I talk about it a little more, because let's face it, if you have type 1 diabetes or type 1 diabetes and you really want to be successful with it, it's work, right? It is really all about not really what's happening with your healthcare provider, but it's about your own personal behavior every day, day in and day out. And if you're going to be successful with managing diabetes over time, of putting out the effort and the behavior, that means you've got to have the oomph to do it. Your emotional health is going to be important, and that's going to contribute to your diabetes efforts and contribute to your diabetes care. And we know there's something that makes this even harder when we think about the chronic condition that is diabetes, uniquely from others, which is that, most of you understand this. I mean, the day you were diagnosed with diabetes, the universe said to you, "Hey, congratulations, I have a new job for you to do. There's no pay, there's no vacations. We'd like you to do it for the rest of your life. And of course, keep paying attention to this on a regular basis." And even worse, we know that human beings respond really well to positive, short-term, tangible incentives, like being paid for your work every day. But diabetes is pretty peculiar because the real rewards, the real benefits are in the future, right? Like, if you can really pay attention and take good care of yourself over the course of 5, 10, 15, 20, 25, 30, 40, 50 years, the real benefit, if everything works out really well, what's most likely to happen to you, if we're lucky, is, well, nothing. We don't want you to run into any of the scary long-term complications. But the reward of nothing happening is kind of an odd kind of incentive, since we as human beings respond better to these tangible incentives. And then, of course, the other issue is that you're asked to take on the job of diabetes, which is doable, even though it's work, but you're asked to take this job on top of everything else you're doing, all the other jobs you have in your life, like making sure you can support yourself and make sure your kids are fed and keeping yourself safe. And it's amazing. And we should be celebrating that actually anybody manages to pull this off over the course of time. It is to be celebrated. And we know that this job of diabetes gets harder when, life gets in the way, when there are other kinds of emotional struggles like depression or significant anxiety or tragedy in our lives, or, COVID. All these things to just make that work so much harder. Now, we understand there are a lot of more significant, serious mental health issues that do occur with diabetes. Like, we know, for example, that really significant depression is prevalent right now, and maybe 10%, maybe a little more than 10% of folks with diabetes, both type 1 and type 2. And there's some discussion about whether that's really more common than people who don't have diabetes, but still it's at least 1 out of every 10 people. And that, makes life miserable, whether it affects your diabetes care or not. But there is one other emotional struggle with diabetes that's a lot more common than depression. And it's something that we, of course, uncovered many, many years ago, we call diabetes distress. And diabetes distress is really about the felt burden of living with what is a often tough and demanding disease. And we see the things that contribute to it, how people can feel often just out of control, hopeless and helpless, and feel like this disease is going to get me no matter what I do. Feeling discouraged when you feel like you're putting out your best efforts and you're not getting the results you want. In fact, it's probably one of the more common complaints we ever hear, especially from people with type 1 diabetes. I did the exact same thing today that I did yesterday, and look at these wacky blood sugars. Or running into scary complications, even after you've done a great job. Or getting chewed out by your healthcare provider when you've made every effort you can. Discouragement is a real issue. And then there's just exhaustion. Again, we know for many people, it's the issue of what we call the 24/7 problem. People saying, especially with type 1, boy, I never get a break from this disease. And then having unrealistic expectations. If you feel like you're supposed to have perfect blood sugars all the time or eat perfectly, which is never going to happen. And we know that this problem, the bigger problem we call diabetes distress, from all of our studies suggests that it's at least 1/3 of people with diabetes right now. And in some populations, it's going to be at least 50%, half the folks with type 1 and type 2 both. So we see how diabetes distress really can drag you down, because high levels of diabetes distress are linked to poor self-management and lead to higher A1Cs, less time in range for people on CGM. And we know that people with high levels of diabetes distress can present with a range of different problems. I see it in my office every day. People with pronounced fear of hypoglycemia, for example, with low blood sugars, that really can overwhelm people's lives and make it very uncomfortable, especially if it leads to you just keeping your blood sugars high all the time. There's often all sorts of problems with disordered eating, when food feels like it's the enemy and not your friend. There's people who just pay too much attention, obsessive attention to diabetes, and end up trying to keep their blood sugars actually too low, and then actually have more problems with hypoglycemia. Lots of people just blowing off their diabetes, right? And maybe avoiding glucose monitoring or not coming to healthcare provider appointments and just saying, I'm going to try to minimize how much I pay attention to this disease. And often that can lead to problems as well. People can feel guilt-ridden because they're not doing what they feel like they should be doing. Again, discouraged, depressed, hopeless, helpless. And then family members often have all sorts of problems, especially when they inadvertently, despite their best intentions, become kind of nags, right? Because they care. They become what we call the diabetes policeman. And if their loved ones are having trouble with hypoglycemia, maybe they're having trouble with insomnia. So there's often a big issue for them as well. Is this also being made worse by the pandemic? Well, I have to tell you from a research perspective, the data is a little unclear, but clearly we know that whether they have diabetes or not, so many people have been struggling with feeling more isolated and feeling more down. And for that group of folks, it can definitely make it harder to find the oomph you need to manage diabetes. So I know I need to stop soon, so I just want to make sure I want to highlight the good news, which is that we know that people who are really emotionally struggling with diabetes have high levels of diabetes distress, or when it gets really high, what we call diabetes burnout, when you just can't even take it anymore, that all of those kinds of issues can be resolved. Believe me, that's why I continue my job every day. We can help people regain a sense of control over diabetes. They can regain a sense of making peace with diabetes. And often it's all about gaining a new perspective, to know that if you really feel like you're emotionally struggling with diabetes, you're not alone. That, in fact, again, maybe half the folks with diabetes are probably feeling pretty similarly and struggling in ways that are private because they're not something you'd hear about unless you really ask about it. If you're having a tough time managing diabetes, if you don't have perfect blood sugars all the time, you're not a bad person, right? These are just numbers. And there's no reason we should be shaming and blaming anybody with type 1 or type 2 diabetes ever again. And also all our new data shows that you're not doomed if you have diabetes. We have more and more evidence that with good care and good effort, it's pretty good you can live a long and healthy life here in the 21st century, even with type 1 or type 2 diabetes. Such good news that we don't tend to share enough with folks. And the bottom line is we know you can feel better and you can achieve greater success. And it's really a matter of working together with a good healthcare team. So I hope this has been perhaps a good start for what we're going to be talking about more in our panel today. Really glad to be here, and I'm looking forward to hearing more and sharing more with you. Thanks again.
Thank you, Dr. Polonsky, and for that helpful context. What a great way to set up our panel discussion. With that, allow me to introduce you the rest of our panel, our esteemed guests tonight. Starting besides Dr. Polonsky, it is also Kovler's own Dr. Lou Philipson. Dr. Philipson is an endocrinologist, a leading world authority on diabetes. He is the James Tyree Professor of Diabetes Research and Care and the director of the Kovler Diabetes Center at the University of Chicago Medicine. We are also joined by Dr. Tina Drosis, a clinical psychologist and associate professor of psychiatry and behavioral neuroscience here at the University of Chicago Medicine. She specializes in helping patients cope and adjust to a chronic medical illness. And finally, a very special welcome to Nick King. Nick is a college student studying public health and a patient of the Kovler Diabetes Center. Nick is kind enough to join us from his college campus this evening and share some of his story with us. So welcome, everyone. Let's get started. Dr. Polanski, I hope I am not mispronouncing too much your name. I'm so sorry, but let's get started with you because I think you had so many, positive comments to tell us about. It's not doom and gloom, but how did you get to where you are and did you meet with patients? How did you see this need for mental health?
Well, I feel, thank you very much. I feel super lucky. I think I mentioned a diabetes psychologist now for more than 30 years, almost 35 years now. And, there weren't a lot of people working in my field in diabetes back then, very, very few. I know Dr. Philipson actually knows some because of his work with the Diabetes Control and Complications trial. But, what I was been lucky about all these years, especially back when I used to work at the Joslin Diabetes Center, is really have the chance just to meet thousands and thousands of, well, people like Nick, who've been living every day with diabetes, and allow me to ask my favorite question, which is, can you tell me what's driving you crazy about diabetes? And at least so far, everyone's been able to think of something. No one's ever said, I can't think of anything. And we've used all that to really appreciate how challenging it can be to live with type 1 diabetes every day, and to figure out how we can help people to be successful, because we know more and more people are. So I don't want to be long-winded, because I'm just so honored to be here and be here with Dr. Philipson and everyone at the Kovler and the wonderful work you're doing. So looking forward to chatting with you more and hearing from Nick, and especially.
Right. Dr. Philipson, give us the sense of the need, how you saw this need, how the Kovler Center got started. Okay, Dr. Philipson, I'm not sure if you heard us. I said if you could give us a sense of how the need, what did you see, how Kovler got started, and the need that you saw for mental health challenges that diabetes patients face.
I need a coffee mug that says unmute, please. So I was to say that over the years, Dr. Polonsky's his career has overlapped with mine. I was influenced so much by my teachers, but also by our patients, our people with diabetes who struggle so much. We often say that they think that you've got to walk that lonely valley by yourself, but in fact, it's the team. And what we've put together is a team that are cheerleaders, teachers, support groups at every step of the way. I have to give a shout out to people who really influenced my thinking, like Lee Ducat, who was one of the founders of the JDRF, Barbara Anderson, who helped set up the whole notion with Bill Polanski of a field of diabetes support, and so many others. But I think from the very get-go, to have people like Dr. Drosis' team involved to help us understand how we can best help people navigate it has really been key.
Right, Dr. Drosis, tell us. I mean, health and wellness, obviously so key to anyone facing any kind of a diagnosis. What have you seen at Kovler?
Yeah, thank you, Mary Ann, and thank you, Dr. Philipson. So this is a great honor for me to be here tonight to talk about our health and wellness program, because I personally am very proud of it. I know the Kovler Diabetes Center is very proud of it. So essentially, our health and wellness program is our mental health program within the Kovler Diabetes Center. We are embedded, or you could say co-located in the clinic, and our mental health providers are actually seeing patients in the same clinic space as our endocrinologists. I lead a team of clinical psychology PhD students who rotate through the clinic, and we staff the clinic 5 days a week. So we're there every single day. And essentially how it works is a patient comes in to see their endocrinologist, discuss their diabetes care, their diabetes management. If a mental health concern arises or a patient has a question, any provider can make a referral to our health and wellness team, and we can actually just go in and see this patient on the spot. Or patients can schedule another appointment with us at their convenience if the date and the time, or they're running to somewhere or something like that. Once we see the patient, we conduct a brief psychological assessment. We make recommendations, which we share with the patient, the family, and our providers, and together we come up with a mental health plan to help our patients. For example, if psychotherapy is indicated for a patient, we are actually able to see patients back in our clinic for some brief intervention work, which I'll describe in a little bit, for up to 4 to 5 sessions. And then if patients continue to need work, then we can help them secure a referral out in the community. Then once patients come back to see their endocrinologist, we follow up with them. We make sure that they're still seeing their therapist or receiving the mental health care that they need. If not, we resecure another provider and we start from the beginning. And we are just so humbled to be working with this population and to be working with Kovler. So thank you.
Well, let's talk about all of you. Let's talk about what are the key strategies for success. What is it that you believe in taking on these mental health challenges? Dr. Polanski, what do you see as a strategy that's been successful?
Well, before I answer that, I know we have Nick here, who actually is living every day with type 1. And I'd rather start with, if you don't mind, I want to ask him, Nick, Nick, I know that, again, you're probably like everybody else, you can go through tough times with diabetes. What's helped you? You're my expert. You tell me what's worked for you.
Hi, thank you. I would say what's helped me most is the diabetic team. And what that means is the people surrounding you, the people that are helping you manage your disease. So that would be doctors, family, anybody that's in your corner. And I think that goes a really long way because the support really matters when you're feeling low and feeling down and you're just angry, upset, and frustrated with yourself and or diabetes. And having those people in your corner to say, hey, keep going, we got this, this is a manageable disease, and you can live a happy and healthy life. I think that is the most effective support.
I think we should also have a little more about Nick, because you're right. Nick, we haven't heard your whole story, your journey that you've taken. You're a college student at the University of Illinois. Tell us a little bit more about your finding out that you're a diabetic and how it has evolved for you.
Yes, I was diagnosed with diabetes at 4 years old, and it's really been me and my mother tackling this disease together. We started seeing a doctor, and my mom did most of the talking with him. And then I transitioned into the University of Chicago Medicine in a program, I believe it was called In Transit. And what this did was it helped an individual, preteens, people that were given a lot of help to transition them into managing their own diabetes independently.
Did you ever face a time where you struggled with perhaps being angry, mad, sort of that why me?
Yes, there were many times, even to this day, that I think and ask myself those questions. But what I really have come to learn is that diabetes is a manageable disease. You can live a happy and healthy life with diabetes. I would also say that it's just really important to have those people in your corner and to be educated on diabetes and to be honest with yourself and to admit, hey, I'm having these rough days. Not every day is going to be perfect. There's going to be some days that are going to be bad no matter what you do. If you do everything right, it still can turn out, downwards. And there are going to be those days that everything goes right. And I think you have to find a happy medium between them to really succeed.
You're a student at University of Illinois. I understand that you also work with the men and women's basketball team. You seem to be living a full life. I think that's encouraging to others who might be like, oh no, now what does this do to my lifestyle?
Yes, so when I was preparing for college, my A1C was higher than normal. I would say it was around 11 or 12 at the time. And I was working with Dr. Philipson to target how do I go down to college and continue living a healthy life. And the plan that we kind of came up with was keep doing what I'm doing and put my health and diabetes first, put my mental health first above everything else. So if that means if I wasn't feeling well, do I go to class or do I go to work? No, stay back and I have to take care of me. And then once I'm good, I can do everything else.
Very good. Dr. Drosis, you must be listening to Nick and saying, exactly. I mean, this is the kind of work that you and your team do, making sure mental health is right at the top priority.
Yeah, thank you, Mary Ann. And I think that our program is a unique program at the Kovler Diabetes Center. And I think one of the few reasons that we've been successful with this program is, the first is we really work at decreasing access to care barriers. So a patient comes to the endocrinology appointment, and if there's mental health concerns, because we're embedded in the clinic, we're able to help those patients right then and there. Instead of saying, here's a referral, go try to navigate finding a psychologist within the community. Access is hard these days, and so being able to do that right in the clinic is really important. I think another reason why we've been successful, and I think Nick mentioned this especially, Dr. Polonsky mentioned this, day one at diagnosis. We try to meet all of our new patients at diagnosis or soon thereafter, and I think that the message that is being sent there is that our diabetes center knows this is a difficult disease, knows this is a 24/7 disease, which was mentioned a few times, and we know it can have a negative impact on your mental health. So we're going to address those things right from the get-go and be very proactive about it. I think what that also does is help to destigmatize mental health. I think mental health still has a negative stigma in our society and sometimes in our communities around. And so being able to have mental health providers alongside the endocrinology providers, I think really sends the message to patients with diabetes that, hey, there is nothing stigmatizing about having distress, having depression, having anxiety while you're managing this disease.
Dr. Philipson, you have been, you've seen Nick over the years, and so give us also your take on how you've helped him address challenges that he has faced.
You know, I don't want to underestimate how hard, you know, it was, and how Nick and everyone, I think, who was a young person with diabetes struggles to get to this place. And some of it is an inner resilience. Some of it is to have the support of family and friends, but it's been hard. And Nick, you know, I think what I'd love to hear from you is what you would tell yourself back then. I mean, one of the things I saw, another of my patients was a blogger, and once I read her blog about me and that interaction, which caught me up short. She said, I went to my diabetes doctor, we had another math lesson today. And I don't recall ever raising my voice, but it's just what Dr. Polonsky said, is people think, well, your diabetes doctor, your endocrinologist is not with you, and also you personify the diabetes doctor is the enemy who is reminding you have diabetes. But if you could think about that and talk to yourself back then, you know, how would you deal with that? We had tough times.
Yes, and Dr. Polonsky,
We did.
Nick, you weigh in as well. I'm sorry, Nick, go ahead.
Yeah, we did have some tough times together. I never viewed you as the enemy. I always saw you there to help me, and it was hard. It was challenging. There were times where I wanted to quit and I wasn't taking care of myself, and I just completely wanted to ignore the disease. I believe it's called diabetes burnout, where I just wanted nothing to do with it. I was sick of it. I was angry, and you helped me through that. You shared the brutal and honest truth, which was, if you're not going to take care of yourself, I'm not going to let anything happen to you. So if I need to administer you to the hospital where you can be on 24/7 watch, that's what I'm going to do. And I respect that so much, and it really taught me a lesson in saying that, like, I need to be the one that's going to take care of myself.
Excellent. And also, Nick, I think it also proves that, you know, you took care of yourself and you've had a big support system. Dr. Polanski, you've talked about that. You're not alone, and how much that, without being the diabetes police, that support system helps.
Yeah, and again, I hope people who are viewing this realize just how unusual Kovler is, and how unusual Dr. Philipson is, by the way, that to have a healthcare provider or a team that is really on your side, that someone who's actually listening to you, isn't blaming and shaming you, and actually is, you know, rooting for you in that kind of way, is unfortunately still kind of unusual. And you have a remarkable thing at Kovler, and especially, as Dr. Drosis said, you actually have, you know, people like me, mental health professionals, right there on staff, available. That's so wonderful, and again, very, very rare in this country. And what Nick said is, I just got a big smile on my face, because it is the number one thing that we've learned, that we tell everybody all over the world, which is that, you know, the secret, you know, if you want to live a long and healthy life, the most important thing is you want to have people in your life who are rooting for you. And that's, Nick, it sounds like that's one of the things that's really helped you just tremendously. And congratulations. I know it's not going to be all roses and rainbows from here on, but it's really nice that you got a team that's working with you. Congratulations.
We've gotten some viewer questions. Nick, I'm sorry, go ahead.
No, go ahead. I was just saying thank you.
No, you know, you're the star of tonight for sure, because when you hear from someone living through it, it's a lot of talk, but when you hear from the guy who's facing it every day, it goes right to those mental health challenges. In fact, one of our viewers has sent in a question, Nick, saying, our son has type 1 and is a freshman in college. What advice do you have for us as parents when we send our kids off to school away from home? It's scary for us parents, yeah. Nick, talk about that.
I would say trust your child. I think that there comes a point in time in a diabetic's life where you make an internal decision to say, I'm doing this for me in my life and not anyone else. So whether that be in high school or college or any other time in your life, that you just have to have a foundation of trust and to say, I believe that my child can do this and he can take care of himself and handle himself.
And how much, you know, at the same time, Nick, you can't help as a parent to say, you know, hey, honey, how you doing today? I mean, does that get old, or do you want every now and then, does it feel good for someone to ask you? Because, you know, it gets a little old checking your numbers all the time.
Yes. At one point, I believe during the diabetic burnout, I would get fed up with the questions, what are your numbers, what's your A1C? Now that I've grown, I love the question. I feel like people are showing their support and that they care, and I get a sense that it's very genuine, and I love that. So I'm willing always to share my numbers, advice, anything that I can do for anybody, because I've been through it. I know how, you know, tough it is. So if I'm going through it, I'm more than willing to help anybody else that is affected by it.
Dr. Drosis, talk about that. I mean, your team sees it and meets with young patients, probably older patients as well. That burnout question has got to be a top of mind.
It is, and it's one of the main reasons we see patients when it's not the beginning. It could be a year later, 5 years later, 25 years later. But it happens, and it happens to most patients, and they go through it. And I think one of the main things that we try to do when we see patients who we think are experiencing diabetes burnout is really to validate that experience, listen to them, empower them, validate them, and really trying to convey this message that, hey, we hear you and we're here to help you. And sometimes we have patients take the breaks because if they're able to have a support system in place, that support system, whether that's a significant other or a parent or a child sometimes, or adult child for that matter, can come in and sort of help you manage and take some of that diabetes distress and that diabetes burnout. We all need a break from diabetes. Patients with diabetes do not get a break. I think that has been a clear message this evening from all of our speakers. Nick alluded to that. It's a 24/7, 365-day disease. And so the burnout is very real. And I think the validation is one of the most important aspects of starting to manage burnout.
We have another question from a viewer for Dr. Polanski. And there is someone out there who is asking tonight, what are the strategies family and friends of type 1 patients can do to support their mental health while managing this disease?
You know, that seems to tie into the last question. So let me see if I can try to answer them together. And by the way, Nick, thanks for the shout out, since I wrote a book called Diabetes Burnout. So it's a subject near and dear to my heart. When I think about, you know, parents who are sending their kids off to college, and I think about family and friends who just want to make a difference, you know, the most important thing we like to say is it's important to have a conversation with your son or daughter to come to some guidelines, like just have a conversation in a dispassionate moment. So not when everybody's upset, like what's the best way for me to continue to be engaged with you about your diabetes, even though you're off in college, or even if you're here in town? How do I keep my nose out of your business, but on the other hand, I kind of need to hear from you every couple of weeks and know that you're still alive? And for those, folks who are wearing a continuous glucose monitor, especially if you have like a Dexcom share system, that opens up all sorts of opportunities, but also potential problems in terms of, is someone following my data remotely? And that leads to all sorts of issues about what we call diabetes etiquette. And again, all that's solvable just when we encourage family members or friends to have just a conversation with their loved one with diabetes about, let's figure this out together. How do I be involved? How do I respectfully keep my distance? That's really what makes it different.
What it sounds to me, and all of you could take this, is that really it's talking, it's communication, it's being aware of what's going on. Dr. Philipson, meeting you for the first time 10 years ago, you have a way about you of telling the truth and also saying, hey, you know what, we're going to get through this together. How important is that communication?
Well, it's critical, and I think Nick is shaking his head. I think we have to be able to talk, and we have to have honesty. We have to, someone said it. It's like looking in the abyss, is seeing those terrible complications that Dr. Polonsky alluded to that we all have in the back of our heads. But we can't function on a day-to-day basis by thinking if my blood sugar is high, something terrible is going to happen to me. You have to get through the day and manage one thing at a time. Sometimes it's humor. I think this problem of keeping the relationship separate, that you're my mother, you're my wife, you're my child, and I'm not your doctor or your nurse. Those are some things to try to get over. And one of those things means sometimes humor. I at one point stumbled on something, Bill, you may have seen. You don't say blood sugar anymore, you say, how's your banana, or some other word, and soon it becomes a point of humor, not of contention. So those things to create space, to love people, accept them, and be there for them when they need it, those are critical things.
Well, Lee is watching tonight, and Lee has a comment, not a question. Lee says, Lou Philipson is the paradigm of his profession. He has navigated the ups and downs of diabetes for 16 years, ever since the time when the Kovler Center was just first established, and he has been my quarterback at every turn and helping me navigate diabetes medically, psychologically, and all levels. So that's terrific, that Lee, I think that comment, yeah. So applause.
So
any of you,
I paid Lee to say that, by the way.
Let's any of you take this one. Are mood swings part of the daily life of a diabetic? And what about those mood swings? Who wants to weigh in?
Well, Nick, why don't you, just any day, the ups and downs of any single day, and why don't you say something about that?
I believe mood swings are very real for a diabetic. And I can speak on that because at least for me personally, when your blood sugar is high, my head starts to hurt. I always have to go to the bathroom. I get a little jittery. So I feel as though I'm in a different psychological state than I would if my numbers were normal. So mood swings, it can make me a little irritated, a little irrational. When I'm low, I tend to get a little belligerent. But I think that mood swings are very real for diabetes, yes.
Dr. Drosis, how about that? On the mood swings, what do you tell patients about that?
Yeah, so I think Nick's comments are spot on. So there is sort of the medical side of the mood swings related to your blood sugars, right? If you're high, then you might be feeling a certain type of way. If you're low, you might be feeling a certain type of way. That could cause mood swings. The other thing that can cause mood swings are mental health disorders. So depression, anxiety, distress, fear of hypoglycemia, Dr. Polonsky mentioned that. All those things can cause mood swings as well. So we just want to be mindful. If somebody is experiencing a mood swing, don't be ashamed. Talk to your provider about it so we can help you understand, is it related to your blood sugars, or is it more related to potentially an underlying mental health concern that the team can help you with?
Dr. Polonsky, did you want to weigh in on mood swings as well?
Yeah, we actually just published a big study last year where we we actually followed several hundred people with type 1 diabetes who were wearing a continuous glucose monitor, and then we had them rate their mood every night. And actually, just like Nick said, what we see across all these many different kinds of folks, there's really no doubt, especially very high blood sugars, obviously problems with hypoglycemia can really wreck your mood for the day. And again, we know this happens quite fairly frequently. And by the way, I just want to say something Nick mentioned. It's very funny. We know that people can experience such different mood states, especially when they're low, but I never met anyone who gets particularly happy when they're low. It's always some form of belligerence or misery in some form, which is unfortunate. I'd like to see someone get happy when they're low. That'd be a nice change.
Exactly. We also wanted to, Nick, I understand that you have someone who helps you while you are away at college. Tell us about that.
Yes, so I have a diabetic alert dog. She is a service dog for people with type 1 diabetes. And what she does is she smells the chemical hormone that changes within your blood sugar. So when I would say about 250 and over, and I just gave myself some insulin, she can start to smell the change dropping in my blood sugar before my CGM, my Dexcom, picks that change up.
Wow. Tell how long have you had Ray, right? Your dog Ray. Tell us how long you've had her, and what kind of difference does that make for you?
It makes all the difference in the world. I've had Ray for about 1.5 years now, and she is a service dog. She alerts me when my blood sugar is dropping or going too high. But the other part of that is she's also a companion. So on the nights where I constantly give myself pump injections because I can't find a spot, or the CGM didn't go in right, or my blood sugar is just too high and I have to get out all the different syringes to bring it down, she's sitting on the floor with me and she's crawled over my lap, and she makes it worth it. She makes it easier.
So Mary Ann, could I just jump in? I just want to say two things. So one is that, so I've talked to Nick about it. He knows that I'm not on board with the scientific explanation of what the dog does, but it doesn't matter. I mean, at some point, the fact that Ray is there and comforting is all that's important. I suspect that there are subtle cues that Ray's picked up on. I don't know what Ray is smelling, but dogs are amazing, so I think it's great to have one. So I would be cautious about the science here at a minimum, but the importance of a companion can't be underestimated. I appreciate what Bill would have to say about that, but I also want to talk about the team just for 1 second. And many of you know that I work very closely with diabetes educators, and especially Amy Hess, who's been just a world-class companion, who is just a terrific cheerleader. And I think that just emphasizes the message of more than one person in the room supporting people. And partly the whole idea here is that we have low walls. We have diabetes educator, we have PharmD, CDEs now, we have nurses who are in the room, and having all those people together, I think also makes a difference. So, and Bill, I think that's really what is lacking in many centers, is having a coordinated, integrated approach with low bars.
You are exactly right. I am just salivating as you talk about what you have at Kovler. I wish I want to just move there immediately, except, oh, wait a minute, I live here in sunny San Diego. I'm not going anywhere. But it really is remarkable. And I so wish there were more programs and centers like Kovler around the country. It's really rare.
Absolutely. For Dr. Drosis, we want to talk to you one more time about this. How has Kovler incorporated practices such as meditation as a way to help those living with diabetes to just better accept and manage that burnout?
Yeah, so we employ a lot of different strategies when we meet with patients. They include psychoeducation, which is where we explain to patients how mental health can impact your diabetes, and we do a lot of mindfulness strategies. So mindfulness is actually a strategy that is gaining a lot of evidence in the scientific community. And what we do with mindfulness is teach patients how to learn to focus on what they're feeling and what they're sensing in this moment without any interpretation or judgment. And that can help with managing emotions. I think Victor Garber mentioned relaxation strategies. That's another one, meditation, all of that. We teach patients how to do those in the clinic. And then we can record sessions with them, and they're able to utilize those strategies when they're at home.
Excellent. Well, we are nearing the end of our program tonight, but before we go, I do have someone to introduce, someone whose support has meant everything to the Kovler Diabetes Center, and that is Sally Kovler. Sally Kovler is the chair of the University of Chicago Medicine Kovler Diabetes Center Leadership Board, and we are honored to have her join us virtually tonight.
Thank you so much, Mary Ann, and good evening, everybody. This is such an important time to invest in mental health, and especially for those with diabetes. At the Kovler Diabetes Center, we want to make sure every patient has access to mental health services. To accomplish this, there are a couple of key investments that we need to make. Dr. Drossos, as you heard this evening, is doing such innovative work. We would like to expand this program so no one is left behind. Thank you to those who have supported us. And I'd like to encourage those who have not yet supported us to consider making a gift or getting involved. Donations received this evening will directly support our mental health and wellness programs. Thank you to Al Taylor and Sam Tullman for co-chairing such an inspiring program. And I'd like to thank our distinguished experts and Nick King for sharing how he overcame his diabetes challenges. And thank you to Victor Garber for his appearance and for sharing his journey too. And finally, I'd like to give a personal thank you to Dr. Kenneth Polonsky. As some of you may know, Kenneth will be stepping down as Dean and Executive Vice President for Biology and Medicine to become Senior Advisor to the President of the University of Chicago. His leadership and friendship have meant a great deal to my husband, John, and to me, and of course, to the Kovler Diabetes Center.
Thank you, Sally. I hope you've all enjoyed the program this evening and that it gave you some insight into the outstanding work that's going on in the Kovler Diabetes Center. The University of Chicago has a rich tradition of accomplishment in diabetes research and care. Many of the fundamental discoveries in diabetes were made by Chicago faculty members. Our physicians and researchers are leaders in advanced research and innovative treatments for people with diabetes, as well as improving access to high-quality care among the most vulnerable and underserved communities throughout the country. As some of you may know, my own career began here with a fellowship and later as chief of endocrinology, and then as head of the Diabetes Research and Training Center. Today, the Kovler Diabetes Center is one of only 7 designated National Institutes of Health diabetes research and training centers in the nation. I'd like to acknowledge Dr. Lou Philipson, the head of the Kovler Diabetes Center, and the other faculty and staff who were involved this evening. I'd particularly like to acknowledge the leadership of Sally and Jonathan Kovler, who have generously supported the Kovler Diabetes Center from its inception and have helped to improve the health and quality of life of countless patients and families. Again, I hope you all enjoyed the evening, and I thank you very much for joining.
It has been a very fabulous discussion. Number one, talk about it. That is the main message tonight. So important for all of us to talk about it. Thank you all for watching. It has just really been a wonderful evening. Thank you very much.